Bismillahirrahmanirrahim. Today we will have case quiz number 122. Case data: 19 years old female. The patient complaining of headache for 3 months, with fever and vomiting for 4 days, altered sensorium for 1 day, with no history of convulsions or head trauma. Earlier, the patient was taken to a private hospital where she was intubated in view of low Glasgow coma scale. But the patient couldn't remember the exact date for this admission. Examination: the patient was suspected to have chronic meningitis by clinical examination. So the first diagnosis based on clinical data was chronic meningitis. Investigations and initial management: the patient did computed tomography, CT of the brain and cerebrospinal fluid. Analyses were done also, which was suggestive of tuberculoma. The patient was started on anti-tuberculous treatment along with steroid but showed no improvement. Later on, the patient developed seizures of generalized tonic-clonic seizure, semiology, and anisocoria. Neurologist opinion was taken for the same and advised for magnetic resonance imaging (MRI) and the magnetic resonance angiogram (MRA) of brain and the CSF analysis again. CSF analysis showed mildly elevated proteins and normal cells. ANA was negative. HIV was negative. MRI and MRA of the brain showed multiple infarcts, constriction of posterior communicating artery, and irregular beading appearance. So, abnormal MRI, MRA with negative ANA, negative HIV, CSF more or less normal unless elevated proteins. The patient had history with acute onset of fever and altered sensorium and seizures, but headache for 3 months and previous history of low Glasgow coma scale. So, what is the case? Take a while and search for the case and answer to this question: what is the diagnosis? And as usual, we will leave you for 6 days and the answer will be online on next Thursday. Wassalamu alaikum wa rahmatullahi wa barakatuh.